Hi and welcome. I'm trying to learn medicine. Today bronchitis, and after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, then it's better the Augenrisk. And this is no medical advice, we're just learning about it, and this is about an illness and about internal anatomy. Yes, and this is part 2. And now we're trying to learn it in a presentable manner, so you can just say, what is bronchitis? Now, bronchitis is inflammation of the bronchi. After the trachea goes down, we become a bronchi. And they are inflamed. We haven't done chronic bronchitis. But we're staying by, so this is now called bronchitis. Okay. It has a wheezing, breathing, persistent core. People can have a wheezy breathing sound and cawing, and phlegm which can contain pus, giving it a yellow or greenish tinge or color. Also to have people loss of appetite, headache and fever oftentimes. 1 to 3 weeks. If the people are overall healthy, the course of a disease or illness is mild. It can be caused through a number of different germs, viruses and bacteria, which invade the lining of the tubes, leading to the lungs and set up inflammation. And by bronchitis, this lining of the tubes of the bronchi are swelling, and that narrows the tubes. And then outpouring, that doesn't mean to pour it out, that is meant inside of the tubes, whereas the phlegm poured out. And now it gets more stuck. And this is made worse by outpouring of mucus, of phlegm. The irritation causes the core. A general upset. It can be serious for babies, older people, and probably also for people with an issue with their health or whatever. Treatment in the home. Generally, it isn't. We don't want to get so much into treatment. We don't really want to give people medical advice. A little overall, just to give a better broad overview of the disease. So basically, rest is advised. But also to contact the doctor if there is art. We don't want to give medical advice. But it would be that also to contact the doctor if it is more severe or breathing becomes labored. Or breathing becomes difficult, I don't know what labor means. And also pain in the chest. When is it wise to rest? And when the thing which we actually think what we want to do, but we want to do a video saying this one thing, because to do not physical activities decreases the possibility of drawing the infection deeper down into the lungs and causing malaria. As prevention, it is advised not to smoke and not to be in smoky atmospheres. Not to sleep in cold bedrooms and avoid contact with people with colds and chest infections. Do we name something of that? We are more here for the disease itself. Okay, I think we have it. Let's look if we can do it. Wheezy breathing and cawing, persistent cawing. Wheezy breathing, persistent cawing, and phlegm. May containing pus. Wheezy breathing, cawing, and maybe phlegm, which can be then, because of the pus and the phlegm, yellow or greenish. It is caused through a number of germs and bacteria and viruses, and they can cause inflammation of the lining. Is that right? Yes, inflammation of the linear swell. And when one swell, of a bronchi, after the trachea comes the bronchi, and when one swell and that narrows the air path, and when there's also a lot of mucus, phlegm, there's not a difference. I think mucus is always there, and phlegm is when not always there. Is that the thing? And mucus and phlegm, I think I can say it like that, is produced and also eventually pass. And this all these irritations cause when we're cold. If for most people, for healthy people, it lasts for around 1 to 3 weeks. If people have health issues, I don't find the proper words, but it is the proper description. Having other diseases which affect the general health. If for people who have a burden for another disease, it is more problematic, and for babies and for elder people. Generally, it goes away with just after 1 to 3 weeks. And again, there's no medical advice, and that is according to Keith Hodgkins' family medical advisor. And not to physical activities, because then it could be drawn down deeper into the lungs and causing pneumonia. Really breathing persistent core and phlegm containing maybe pus, which gives us the yellow. Do we try it? It's just these 3 things. Yes, and then also loss of appetite, headache, fever. When description, it is inflammation of the linum of the bronchi and outpouring of mucus, phlegm, and other secretions. And then it can be problematic for babies, elderly, and people having other health issues. Generally, it goes away after 1 to 3 weeks of rest. I think camera when it's started now. That is a wise idea. Bronchitis, that is an illness oftentimes being brought about. Is it an illness? I think it's an illness. Bronchitis is an illness often caused through germs, viruses, or bacteria, and it causes the bronchi, after the trachea comes the bronchi in the lung, to be inflamed. They swell a bit, and then also secretions, mucus and phlegm are produced overly, and that causes the cold. Symptoms are wheezy breathing and persistent coughing, and also phlegm, maybe containing pus, which gives us then a yellow or greenish tint, and also headache, fever, and loss of appetite. And normally, by healthy people, it goes after a mild course after 1 to 3 weeks away. It can be problematic for people who have other health issues and for babies and for elder people. If physical activities are done while people have bronchitis, then it can be drawn down deeper into the lungs and cause pneumonia. And that's not good. And that is according to Keith Hodgkins' family medical advisor, page 103. And this is no medical advice. It was the most. Let's see. Maybe we should do it just in the next one, because I wanted to do the other video the other time. Let's just do it. I'll start the camera. I don't know. Did I set it all right? why not to do physical activities? That's the question, and the answer is this decreases the possibility of the infection being drawn down into the lungs and causing pneumonia. Okay, what was it now? KYKGHQGQ. Hodgkin. KYKGHQGQ. To limit physical activity by bronchitis is advised because this decreases the possibility of the infection being drawn down into the lungs and causing pneumonia. After the trachea come the bronchi, and these bronchi are inflamed by bronchitis because of a germ, a virus, or bacteria. And when they swell, the lignin of the bronchi swell, and that narrows the air path, and also phlegm is produced, and that is bronchitis. And now by bronchitis, it is advised not to do physical activities because this decreases the possibility of the infection being drawn down into the lungs and causing pneumonia. And that is according to KYKGHQGQ's Family Medical Advisor, page 103, and this is no medical advice. Now we have it. I'm going to stop the camera. And we're going to do the short impingement training. If you were here for medicine, you can go directly to the next part. We will do now the short impingement training. If you participate in the short impingement training, then it's better that your arm is good in stable stance, and we're doing forward shoulder circuits. Up and front, down, and back, up, front, and down. Last one. And backwards, front, back, and down, and again. And now long arms, strong fists, and go as far back as you can with the shoulders, as high up as possible, and in front, and down, and back, up, and front, and down, and now again, up, and back, and down, and front, up, and back, and down. Now into the knees, hinge forward with a straight back, let the arms hang, and pinch the scapulas together with effort. Make fists, lift the arms up and still pinch the scapulas together. The arms again down, and the shoulders. And another time, pinch the scapulas together. With effort. Make fists, lift the arms up and still pinch the scapulas together. Now release, once the scapulas. The next exercise, into the knees, hinge forward, the round back, let the arms hang, make fists, turn the arms to the inside, the arms are up and bring them together. Bring the shoulders back and down. Shoulders down and together, shoulders up and together. And release. And now second round, we are just bringing the arms up. And nothing more. Just observe what the scapulas are doing. And now the arms to the side. And in front. The scapula should go now together. And now around with it. A last time. And in front. And now we are just doing just the stretching. One arm in front. The shoulder is back and down. Pull the arm in. Have flat fingers. Try to relax the arm. Go with back with the shoulder and turn the palm up to the sky. Time lift the other arm, shoulder is back and down, pull the arm in, have flat fingers, try to relax the arm, go a bit back with the shoulder, turn the palm a bit up to the sky. This was a short opportunity. I thank you very much, and until next time.